Hello and welcome to the Soft UK podcast. I'm Sonia Sankoli and I'm the Events and Communications Officer for the charity Soft UK, which is a support organisation for families with trisomy 13 and 18 or Patels and Edwards. This podcast today is part of our series chatting to partner organisations to find out more about what they do. And today I'd like to welcome Helena Dunbar, who's the Director of Service Development, joining us from Together for Short Lives. Welcome, Helena. Thank you for joining us.
Oh, thank you, Sonia, for having me.
No problem. We'll start with the first question then. Give us a little intro of yourself and what your role is at Together for Short Lives.
Yeah, okay. So as you said, I'm the Director of Service Development and Improvement at Together for Short Lives. So I lead essentially what's called the Practice Service Development Team. So we're responsible for all of the direct delivery services to support families with children with palliative care needs across the UK. We also deliver all the major projects and programmes to sort of improve quality of services, and also the team do a lot of professional engagement. I'm also the designated lead for safeguarding for the organisation, and I myself am a children's nurse by background, so got many years of working with children and families with lots of complex needs.
Is that how you sort of got in touch with Together for Short Lives and got to know them a bit more?
Yeah, so I worked in the NHS for about 25 years as a children's nurse in different locations, hospital, community, leading different teams, and I specialised in respiratory medicine, and I always had a real interest, even from when I qualified, of working with children and families where there were children with lots of complex issues and complicated needs, etc. And but I got to the stage, I was consultant nurse in Leicester, and I got to the stage where I had sort of got to the top of the clinical ladder, if you like, and I had decided as a nurse I didn't want to go into management. I loved education, I loved teaching. So I then, as a consultant nurse, I left the NHS and went into higher education. And so I was teaching for 9 years at a school of nursing, and loved that. And then one day, and during that time, I did a doctorate in children's palliative care and worked with one of the local hospices. And really enjoyed that. And then one day, one of my colleagues said to me, "Oh, there's a job going at Together for Short Lives. I think you should have a look at it." I'd been a member of Together for Short Lives for many years as a children's nurse. So I looked at the job, and the rest is history, shall we say.
Well, you kept yourself busy, and it's nice when it comes along when you least expect it as well.
Yeah.
So just for our listeners who maybe never have heard of Together for Short Lives, what can you tell us about them?
Yeah, so we're the UK-wide children's charity that's there to support and speak up for children and families where there's a child with a life-limiting condition. We fundraise to enable hospices and support the children's palliative care sector. We influence policy making, and as I said previously, we work with lots of professionals across the sector, really.
And what would you say the audience is made up of predominantly for the charity?
Yeah, so we sort of work, Sonia, at 3 levels, really. So we offer direct support to families of seriously ill children. So we do that. We offer emotional support, financial and practical support and advice. We've got an online family support hub. And I can talk a bit more about that in a bit. We also work at that delivery level. So as I mentioned, we support the 54 children's hospices across the UK. We work with colleagues in the statutory sector. We work with many different healthcare professionals, supporting them. And then the third level is we work across the wider health and care system, where we We influence, decision making at that highest level. So working with the government, working with, national services, NHS England, education, commissioners, integrated care boards. So yeah, those are our audience, massive group of stakeholders.
Yeah, brilliant. It sounds like you cover a whole spectrum, really. So it's good that you're able to offer so much information across all your members. How do you find your audience? Is it quite engaging? Do the families engage with the deliveries and the resources and support that you do offer?
Yeah, so we have different projects, programs that are delivered at different times in different areas of the country. So, for example, at the moment, we have a program called the Kentown program running in the northwest of England. And that's a program that sort of looks at supporting nursing delivery, family support workers and service coordinators to support families. So sometimes, our programs are geared for different parts of the country at different times. But our family support hub is open. It runs on a Monday to Friday basis. We have a helpline where families can pick up the telephone and ring us, or they can come through our live chat facility or emails. We also have, a private Facebook group, and there's over 600 families in that at the moment. And we have a group of parent experts. So our families engage at different times and in many, many different ways. In terms of professionals, there are 15 children's palliative care networks across the UK, and we try to get out to their meetings. That's a lot easier now with online facilities, and most of them are online. And it's really important for us to get to those because they have a wide audience of professionals, stakeholders, commissioners, service deliverers that are at those meetings, and it's really important for us to be there to influence them, to bring them up to speed with what's happening at a national level, at a policy level, and to find out what they're doing in their different areas, really. And then we have our head of external affairs, who links in from a policy perspective with at government level, really, and leads the group that we have, an APPG for children's palliative care. We have a massive spreadsheet of stakeholders and professionals that we link in with.
Good to have that in your back pocket.
Yeah.
What would you how would you say the programs that you run come about? Are they sort of suggested from families, or is it through research that you've seen issues that have come up that need to be addressed? How do you know that's sort of the need for that area or anything?
So we have obviously a fundraising team, and we have 3 sort of areas of fundraising. So we engage with trusts and foundations, we engage with corporate partners, and also sort of philanthropic giving. So as an example, the programme I talked to you about in the Northwest, that came from a major funder who was really interested, the Kentown Wizard Foundation, in supporting children's palliative care, and they approached us and asked us, how can we help within the sector? What's the need? And so we were able to look at over the years, there's been a lot of prevalence data and research that's identified areas within the UK where there are higher numbers of children with what we describe as life-limiting conditions. But we also have done our own mapping work at Together for Short Lives, where we can actually see which areas of the country provision is, for example, we talk about 24/7 care, so we can work out which areas have the greatest need, and we try to adapt the projects and programs that we deliver around that need. Or we have a partnership with Morrison's at the moment, and through that we're sort of supporting community outreach workers in 3 different areas of the country. One of our other programs is looking at communication needs and how we talk as professionals to families, and what families want from that. So a lot of our programs and what we do comes from our engagement with families, as you said, what they feel are the biggest needs, how we can then find a funder really to support that, and identify it. We have a 10-year strategy that we've just published earlier this year, and in that strategy, our 3 main aims are improving access for families, improving quality, so that they get the best care and support that we can deliver, and also about improving sustainability. So everything that we do aligns back to that strategy. So if I was thinking about a new program that I wanted to start tomorrow, for me it's got to be about, is it going to improve access for families? Is it going to help that quality, and can it be sustainable? I think that's one of the most important things. There's nothing worse putting in a new service and then taking it away when the money runs out.
Yeah, and it's also about the longevity of it,
Absolutely.
if it can be sustainable enough to take it long term, that's going to offer it. Because the worst thing to do is if families are benefiting from it and then it's been taken away, it's a real struggle. It's interesting that you said the program about the communication side. It's something we've as a charity are looking into to reach out to professionals about as well. And
excellent.
As a small charity, we recognise that we do have topics and themes that come up quite in common. The families have in common with each other, and it's something that we can share to external communities about experiences that we've got, firsthand, to help improve systems and processes. So we are actually, in separate to the podcast, doing webinars aimed at professionals, aimed at families, to give them more understanding of how they can handle communication around certain parts of their journeys and stuff, and the language that's used around that, what can be perceived as a good experience, a bad experience. So it's one way of trying to use our family experience in a positive way, to sort of get in with the experts and make sure that the message is always consistent. So hopefully it's something that's quite in line with what you're covering as well.
I was just going to say, I think the value of working with partners, such as yourself and other charities, is really, really important for these families. We do work with a range of charities, as you know, and other partners, and it means that we can provide other things. So for example, we work with a charity that can provide, a free food shop for a family where a child has died or is at end of life, and those things make such an impact on families, helping pay for travel cost. Again, another charity that we work with, we can provide families with financial support if they've got a child in hospital, just to pay for parking and back and forth to the hospital. So there's a real value in working across the sector with other partners and other charity organisations, for the benefit of these children and families. It's huge.
Yeah, definitely. And again, I don't think our families are quite aware of that as well. So it's great to know that we can signpost them to your links, that will have these connections as well.
Yeah, absolutely. I would encourage you to to signpost your families through to our website and our family hub, offer. As I said, we not only as well as having the helpline, the breadth of financial support that we can offer is, can range from, as I say, a small financial gift through to, recently we helped a family, just be able to buy some new carpet. As you know, many of these children crawl around the floor, and, in this house, they only had floorboards, and that's not appropriate. And so, we can apply to our different partner organisations and signpost families on. So absolutely, really, really do signpost, and we would love to hear from families who, are in need. Last winter, we had a cost of living crisis, as you know, and we made the decision to go out for funding for cost of living grants, and that was supported through our Morrison's partnership, but also a wealth of other funders, and to be able to give families a small pot of money, to help them pay for their added electricity cost. I think, as you know, many of these families have increased technology at home, lots of equipment that costs a lot of money. So again, it's trying to stay in touch with the needs of these families, and support them as best we can do, really.
And it's great that you support them so specifically, because everyone's needs are so different. So it's nice that it's not like a blanket support system where you take the time to listen to the families and like hear their needs, really. So that's really good. Well, you've answered most of my questions within the other questions, which is like a lovely way to do the podcast. I'll probably end with one last question. That would be nice to know. What would you say your most challenging part of your role is with Together for Short Lives, and what do you find the most rewarding, or the part that you enjoy the most within your role?
The most rewarding thing, I'll do that first, is seeing the impact that we can make. I am a children's nurse by background, and this job for me has been part of a UK national charity. I can see the difference that we can make. It's tangible. We have the privilege of hearing, as you will, case stories and talking to families, and for me, that's amazing. When a family takes the time to send you a little email that says, thank you for this is the difference it's made to us as a family. That for me is incredible. The challenge is that we know there are at least 99,000 families out there with children with life-limiting conditions. We're only reaching a small amount of those. That number will grow. For lots of reasons, children are surviving a lot longer. They're transitioning now into adulthood. Seriously ill babies are surviving longer. The conditions that they have are getting more and more complex, and as with everything, there's not enough support there for families. There's a financial gap in terms of from the government, in terms of what the support and the services that are out there. So I think for me, in 2023, that's the biggest challenge, and that a lot of the support that these families get is from generous voluntary donations from the public. We rely on charities like ourselves to support that, and part of why we're here is to change that. And so for me, I think that's the biggest challenge.
I think, as you've mentioned, that Together for Short Lives, runs on such a big spectrum, but you're probably quite a small team, just like ourselves as well. And behind the scenes, people don't see that and see
Yeah,
how much goes on with just like a small team that runs it, which is quite
absolutely.
remarkable.
Yeah, yeah, absolutely.
Well, brilliant. Thank you so much for being on the podcast today. Really appreciate your time for today. Thank you for everyone for listening. We hope this has helped you find out more about Together for Short Lives. We'll pop a link on the website for everyone to read a bit more about it. Whether you're an expectant parent, bereaved parent, family member, or professional, you need support or information, we're all here for you. So please reach out to SOF and Together for Short Lives. As I said, I'll put the contact details for both the websites in the podcast birth. But thank you very much for listening.